Good afternoon and welcome to Yashoda Hospitals. I'm Pratyusha Chaudhary, hosting Nursing Education and Training webinar series live on Facebook every Thursday at 3 p.m. Welcome to this panel discussion. We are really honored for such a wonderful panelists that we have got today. So we have got the very interesting topic forward. And in case if you missed the topic in the initial part, so please make sure that you will also post your questions in the chat box so that we will attend your questions or address your queries at the end of the session. We also have got our expert panelist for the day, Dr. Lingaya sir, our Director Medical Services, Yashoda Hospitals. We are honored for you to have you here in the panel discussion, sir.
Thank you.
Also with this, I also wanted to represent our panelists for the day, Professor Siddhamma ma'am and Professor Gina ma'am and Professor Lisa Leo ma'am. Madams are our principals for Yashoda Colleges of Nursing. So there's a really honored for having such a wonderful session for you today. We will make sure that all the career ladders will be virtually told to you. Before this, if any person after completing their nursing, either it may be GNM, either it may be BSc, either it may be masters. So we need to understand what would be our career ladder. So this session will make you understand what are the advancements that we have got after the nursing. So let us hear more from Siddhamma ma'am as a first panelist. Ma'am, we wanted to make us understand how the evolution of nursing has happened and how we have got from the traditional nursing to the change in the modern era. Can you just explain us, ma'am, about this?
Not audible, madam. Not clearly audible.
Please unmute yourself.
Okay.
Very good afternoon to all. I am Mrs. Siddhamma, principal here from Yashoda Lakshmi College of Nursing. I am very much honored to be on this occasion in this platform today to discuss about the session. So, sir, regarding the nursing evolution, am I audible to sir?
Yes. You are audible.
Yes. So the nursing profession, which is assumed the responsibility for continuous care of the sick, also injured and also disabled, and during the dying for the patients, and also they took the responsibility in nursing and encouraging caring for the people for the health of every individual, families and communities. Also they put forward extending their services to the community settings in addition to the hospitals. This nursing is evolved in healthcare research, management, as well as the policy deliberations, patient advocacy, also postgraduate program. After pursuing that, the preparing themselves to be an independent responsibility for providing the primary healthcare independently for all the individuals and for communities in all the settings. So coming to the history, the nursing continued from 10th to 11th century. The Middle Ages in the Europe during the nursing began working as a part of monasteries and religious organizations. The roots of modern nursing has been beginning from the 8th and 9th century. 18th and 19th century, the roots of modern nursing was initiated. In 1854, when the Crimean War started, the British government requested the Miss Florence Nightingale to aid the military for the soldiers, those who are wounded. So she has done an excellent service in preventing the infections by saving the lives of all the soldiers. That was really made a very good impression for nursing. So Miss Florence Nightingale, who is the pioneer of modern nursing, by introducing hand washing in the environmental hygiene, she has introduced the environmental theory by showing that how the hygiene is very much necessary. So that time itself, the evidence-based practice has been started. So in India, 1871, the first a nursing school was started in the government hospital Madras with a 6 months duration. The diploma midwives program with 4 students has been started. And before that, the Miss Nightingale was started in 1860. She has opened the Nightingale Nursing School. The same nursing school is now called as King's College London. A Thomas Hospital School is called today. So we are very much honored for a pioneer modern nursing who has really introduced the modern nursing. And the profession, the training was the first 2 years initially when they started initially, then slowly changed to the 3 years program. And when the Bombay Presidency Nursing Association established in 1890, the nursing advances into a profession. Then the closely resembled today nursing practice was highlighted to treat the infections, related illnesses, wounds. Miss Nightingale stepped into the preside to treat the lives of people from wealthy families. So nursing emerged as a profession in mid-19th century. So evolution of nursing from household to the hospitals, schools, and outpatient settings was the change. That is the transition of nursing service from household to the healthcare settings. Then later nursing has become a profession, and this is a criteria for profession. To have a criteria, there are code of ethics, and it's a well-organized, strong representation. There are competencies and professional licensure, and it's an autonomy and independent practice. There's so many ethical, evidence-based practice. All these are added advantage for becoming a profession. So in addition to all the associations, nursing associations are helped a lot to become the profession, in addition to the improvement of the standards in the nursing.
So well said, Siddhama madam. I welcome you to this platform.
Yes.
I'm sorry, there was a little technical, network issue.
Okay.
Myself, Shanti Bhattacharya, the head of nursing for High Tech City Yashoda Hospital. I take the charge as a moderator today to the for the audiences today, and the very beautiful, as Pratyusha has delighted the topic on nursing professional advancement in present era. So I would like to welcome you all as a very knowledgeable and skilled principal madams from Yashoda Hospitals into different located colleges and schools. So let me welcome you, because this connect I was, I did not begin with. So you don't build a hospital without its nurses. You do not build a home without its foundation. Of course, we do not build a nursing educational institute without its principles. Yes, so I welcome you all to this webinar platform. We have now, just to the listener, I would like to introduce that we have Professor Siddhama madam, who has more than 30 years of experience, and she is located at Lakshmi College of Nursing at Gowda campus. Let me take the honor to introduce Lisa, who also has 20 years of very rich experience, and she is heading as a college principal located at Sarur Nagar, Yashoda College of Nursing. And let me also introduce Gina Philip, who is located at Secunderabad College of Nursing, and she also has 20 years of college principal experience. I welcome you all. And let me take the honor and privilege to introduce none other DMS, Dr. Lingaya Garu, whose vision is nothing but to improve the nursing standards and practices continuously. I think he is one person who is unstoppable all the time. Remarkable, platform he has created in Yashoda industry. I always, whenever we shared our thought process and the journey of his era till date, he always visioned that how one nurse should progress to the career advancement and opportunities she should click on. So I take immense pleasure to welcome our DMS for all 4 group of hospitals, Dr. A. Lingaya Garu. Welcome, sir. And I thank Dr. Dean, who is Dr. Chandrasekhar. Under his leadership, all principal madams, us, even our nursing students who are, aspiring students and taking lot of benefits out of the colleges and school. Let me just little bit brief about our college foundation, which is located at Gaudavalli Kompally campus. It is a mega campus. We have got beautiful nursing colleges, schools, and paramedical courses, which is like about a technician, physiotherapy, and respiratory therapists, lab technicians, and viewers and listeners can always click onto the Facebook, which is Nursing Educational Institute. Having said this, let us just begin with, we have heard about the evolution of nursing practices. Nurses were only serving the war, their practices at Crimean War at field. Then they've come to the hospital. Let also listen from Siddhama Madam. What are the career opportunities?
Madam, I think everybody should be brief because time already 13 minutes over.
Yes.
I think 30 minutes is there, no?
So we'll quickly run the session. What are the career opportunities?
Brief about their views.
Yes. Siddhama Madam, over to you. The mic is over to you to just say what is your vision on your career opportunities given to the nursing fraternity.
Madam, muted. You have muted. Please unmute. Unmute,
sir.
Yes.
No, madam.
Yes.
Okay.
Sir, before we move to the career opportunities, I just wanted to speak about the expanded roles about a nursing profession. The basic nursing roles are already there, which is the functions: the direct primary caregiver, case manager, referral resources, disaster preparedness, control of communicable disease, acute chronic illnesses with the protocols, standing orders, and palliative case. The other roles are caregiver. Basically, a nurse is a caregiver, nurse advocate, communicator, and teacher. The client advocate, change agent is a nurse leader, nurse manager. So apart from that, she will be clinic nurse, epidemiologist, critical care nurse, nurse practitioner, nurse midwife, and a community health nurse, occupational health nurse, and in addition to the caregiver. So these are the...
So the over to Miss Gina, who is going to put a few insight on career growth and professional development in a form of advancement. Over to you, Gina. Siddhama Madam, you can unmute yourself. Mute yourself, please. Gina, you're there. Gina. Okay. Lisa, over to you about your futuristic and current trends in nursing practices. You can, submit your view on the same.
Thank you, Shanti, and good evening, sir, and good evening, everyone. It gives me immense pleasure to join you all, and thank you for the opportunity provided to share my inputs on the current trends and the current trends in nursing and current trends in the healthcare industry. So, as you all know, nursing is an ever-changing and ever-evolving profession. So, especially in the field of practice. So, you might be a diploma nurse, you might be a baccalaureate nurse, and you wish to take your career to the next level. So, if you wish to take your career to the next level, you need to update yourself with the current trends in nursing as well as in the healthcare industry. So, the topic that has been given to me to discuss about today is about the current trends in nursing and current trends in healthcare industry. So, the first aspect that I would like to talk about is about hybrid healthcare model. So, what is this hybrid healthcare model? Hybrid healthcare model is nothing but a combination of virtual mode and in-person service mode. So, in this mode, the patient has the access to go in for video conferencing, scheduling appointments, and having a review and follow-up as per his convenience. And a patient prefers to go for online consultations nowadays, especially during the COVID-19 pandemic. That is something that we have seen. And many hospitals have the facility of texting the patients and reminding them of their appointments as well. So this is what is about the hybrid healthcare model. The second aspect that I would like to discuss is about digitalization in healthcare specialties. So here I would discuss about the use of electronic medical records, then about the image database, And the entire digital platform is actually used to compile huge patient data, which effectively helps in the clinical documentation of the nurses. Next, I would like to highlight about the telemonitoring programs. Telemonitoring programs are nothing but, especially, for example, in cases of heart failure patients. These heart failure patients are actually connected to mobile ECG monitors, and they are connected to mobile blood pressure sensors as well. And this is eventually connected to the healthy members wherever they are. So any change in the parameters alerts the healthy members immediately. And this is via the smartphone, and the texting messaging happens also as well. The next aspect is that you need to understand the advantage of this particular program. That is early diagnosis, prevention of complications, and there is lesser hospital admissions with respect to telemonitoring programs. The next aspect of the current trend that is widely prevalent nowadays and kind of a talk of the town is about the artificial intelligence, which is adopted in the healthcare industry. So artificial intelligence is used mainly in the accurate diagnosis and the treatment of the diseases. And artificial intelligence is also used in what is called as precision medicine. Now, what is this precision medicine? Precision medicine is nothing but to predict which treatment is ideal for which case and which condition. So that is about the AI. If you take AI, there is another one system which comes into it called as natural language processing system. Now, what is this natural language processing system? For example, the patient speaks to you. The patient verbalizes your complaints to you. So what happens is the speech is entirely recorded. After the speech is recorded, it is analyzed. The text is analyzed. And later the text is translated as well. So this also helps.
So,
Yeah.
Lisa, you mean to say this artificial intelligence will, help nurses in analyzing critical thinking in terms of calculating the fluid and drug calculations, in processing the IV fluid administration process to the patient?
Yes, that also can be done. That is
So you
still
mean
in
to
process.
say this is all programmed software in terms of AI?
Yes, absolutely, because this is always based on software and coding. Okay, so here all the patients have the access also for all their data. For example, nurses also have what you call access to the data with respect to the clinical documentation. That's what I was explaining about the natural language processing system, where there is actual recording of what the patient actually verbalizes.
Kindly, emphasize something about evidence-based practices in the hospital scenario. You would like to provide your insight on the
evidence-based
same?
practice is nothing but, So evidence-based nursing practice is nothing but, giving quality care to the patient based on scientific findings and scientific evidences and supportive research studies. So what is the main goal of this EBP? The goal of EBP is nothing but to provide a quality care to improve the health of the patient, and then for better outcomes of the patient with respect to the treatment. And next is about the cost effectiveness part. And high levels and standards of care is provided with respect to evidence-based nursing practice.
So
and now if you see in the clinical setting, this is mainly used.
Thank you, Lisa. I would like to over to Gina, since we have time-bound presentation here. So Gina, what is your take on career growth and professional advancement for the nurses?
Yeah. Good afternoon to one and all. Before we start into the career prospectus and professional development, these two terms we need to really understand. One is that about career growth. This is like when we are advancing, any employee can advance from a lower level to the higher level. Usually it happens because of the promotions. Okay, and then when it comes to professional advancement, it includes a wide variety of activities, training programs, courses, and it will enable us to move forward in the career as well, but also to gain effective knowledge, skills, and enhance our overall productivity. So these are the differences between these basic terms. Now, when you come to why someone would like to go for a career progression, you all know that we would like, we suggest people to go for career progression because of better perspectives. pursuing a new job or a new role. For example, a junior nurse may go into a leadership cadre when you are going ahead with the career. And there are also increasing in the earning capabilities when you take up a higher level. They have to keep up to date with the new trends and knowledge, what is happening in the research area. That is another benefit. And also, it also add up to the self-care of any employee. That means when you are empowered with the knowledge, they become more confident. Okay, and also they have the courage, and it in turn improves the self-esteem of the candidate. So overall, it leads to job satisfaction when it comes to nurses. But the bottom line is,
Gina, so
I would like to complete this.
Here, I would like to ask you, what are the career growth or prospectus which is provided at our industry? As you said, after 2 years of experience, the nurse pursues 2 years of clinical,
definitely. So I'll come to that aspect where we have different kind of opportunities in different sectors, like in education side in nursing and as well as in clinical side. Basically, these two areas I would like to emphasize. In nursing education usually happens in the academic institution, where you know that a nurse after a basic BSc nursing degree will enter as a teacher after 1 year of qualification, 1 year of service actually after the qualification, and she can enroll as a clinical instructor and a tutor. And if you want to go high up in the ladder, she may have to go for higher education. A PG in nursing is required, where she will have the title of assistant professor, that is with the 3 years of experience in PG. And after 8 years of experience, associate professor, and a professor will have 10 years of experience. And definitely there are vice principal and principal in the administrative level also, who is having more experience in this level. Whereas when we come to clinical nursing side, it depends on different hospitals. Depending on the structure, they will have different nomenclature for this, but we all know that junior staff nurses, and then the senior shift in charges, supervisors, managers, and then assistant general manager or DGM or the GM nursing, like how we have in our setting. So these are the main areas. Now, why we have to, what are the ways we have to achieve this professional development? So I would like to touch upon this. Why someone should go for enhancing their career or enhancing this professional values or professional development. So one is that what are the ways how we can implement this in our organization or any organization for that matter. One is that basically there should be a culture of training and development existing in the institution. Like right now, what we are doing is a part of it, I guess. Okay, that culture we have to develop in our organization, that the entire team is involved and they understand the value of improving our knowledge and be up to date with whatever is happening in the healthcare center, in the settings. Next, it can be done with the different ways, case-based discussions, bedside clinics, or whatever it is. And the main thing that the senior faculty or senior nurses can get involved to enhance the professional development is mentoring. Okay, mentoring services where you take up a junior nurse and teach them about what is going to happen, how she can get adapted to the new system and to improve the capabilities and skill. So along with that, we have in-service educations. Okay, like we introduce a new equipment, new procedure, or a latest technology, what is happening in the on job itself, the new nurses can be trained on that. And we also have CNE programs, continuing nursing education program, which is a little more of structured way we will do. That is a kind of different courses, seminars, workshops, symposiums, panel discussions. Okay, all these kind of activities also can be involved. This all will help the candidate to go for their further professional advancement. And there is also, as we have already mentioned, evidence-based practice and critical thinking. This is very important because without all these things, we cannot go forward. We'll be stagnant where they are. So this is one of the latest trends. Ms. Lisa also have highlighted on this, which we have to adopt to make sure that we are going ahead with the professional and
here over to again Lisa, what do you understand, what you would like to give the take on professional advancement to your new graduates or diplomats when they come as a new students to your hospital, to your colleges?
So first of all, we would like to talk about whether they are really interested in nursing. So
Yes.
they basically need to have the dedication towards the profession. They need to understand the profession. So we start with the basics, and we talk about what is this profession, how you can go about, what are the prospects of this profession. And then we stick on to the entire curriculum as per the Indian Nursing Council. We have the semester-based system also coming from the current year onwards. So there's been a lot of updation regarding the nursing curriculum.
Heard from all the panelists, expert speakers. Now I would like to over the session to DMS sir, as his clinical expertise and you will really enlighten our queries, and we can also learn from him on this day today. So sir, we would like to have your view as well.
Very good evening to all of you. And particularly, I'll appreciate Shanti Madam for this topic, nursing professional advancement in present era. This is the most important topic because many our nursing staff and nursing students who wanted to join nursing, everybody is wanted to know what is the career growth, what is the advancement in nursing. All those things are doubts are there, or they are thinking about it. All these things are there. So it is a very good topic at present era, present time. As Madam told, Siddhamma Madam told, the evolution from 18th century, there is a big evolution is there. I mean, a lot of changes have come in the nursing. I am in the profession, I'm seeing the nursing profession since 50 years, 5 decades. There's a lot of change in nursing. Initially, there was a lot of, problems were there for nursing, and the education was the nursing, education was a very limited education was there. There was no MSc programs or doctorate programs, but now everything is available now. So there's a lot of changes have come in the education system of the nursing. And apart from that, position-wise or designation-wise or professional-wise also, there is a lot of changes have come in the nursing now. So initially, the nurses were not were only obeying the orders of the doctors, and now they are participating in different areas. They are allowed to do investigation, take history, do investigations, and do the treatment. All those things are now come as nursing practitioner, practicing nursing are also there. They are treating. A lot of subspecialties have come. They are going into different specialties. Nursing is now become a very important profession in healthcare system in all aspects, not only in the hospitals, in many other areas. But our principals have told different areas are there where nursing can do their work in healthcare system. And majority of the manpower in nursing is in healthcare is nursing. 42% of the healthcare professionals are nursing. So nursing is a very good profession now. Initially, the respect was less, but there a lot of respect is there. And career growth means there are two, three things are there. One is education. So you can go from A&M, GNM, and all those things. I think Gina Madam told all these things. You can go up to doctorate level as far as education is concerned. And as far as position designation is concerned, all of I think you know that from staff nurse to you can go to any level. Director of nursing is also there now, so you can go to any level. Apart from that, now specialties have come, and even people are now practicing anesthesia also. There are people are treating the patients also. So all these things are available in the. This is a big vacuum. Not only shortage of nursing, a lot of shortages there. Not only that, a big vacuum is there now in the nursing in different levels. So anybody who wants to join nursing or anybody who wants to grow in their career path, first they have to think. As Madam Liza told, dedication is required. Without dedication, before selecting the job profession, you have to think about it. And if you are joining the nursing profession, you have to have dedication for your profession. You have to sacrifice your family, personal things to some extent to the professional level. If you want to grow, if you want to have a good career. So if you work with passion, and put for yourself a goal, what you want in your career. Financial care is also one more thing, but when you work passionate and educate yourself, update yourself in your profession, I think you can go to any level in the nursing profession. So one thing what I am telling is, for our nurses, technology is changing very highly. You have to know what is the technology, how it is growing. Our people have told now artificial intelligence, robotic is there. All these things are coming into the nursing. So you have to update your knowledge about all these things. Then particularly juniors, staff, new sisters, what I am telling, technology and communication, particularly software systems, computer systems, all these things you should know. If you don't know about technology and computer software, this thing, you will be lagging behind. So first, when you want to join this nursing courses, you have to keep all this in mind. And those who have joined, those who are working now, also I am telling them, be passionate about your profession. Work passionately. Don't think about financial things. Financial things automatically will come to you when you are doing a good job, efficient job. To do efficient job, update your knowledge with this type of webinars. And then in education also, you take one by one step, like general nursing, BSc, MSc, and doctorate. All those things are there. And positions automatically will change. Position will not change with your seniority, I'm telling you. Positions will change with your efficiency. You work efficiently, and what I have seen this in our nursing, this thing is communication is very important. They have to improve their communication skills, computer skills, know about technology, and work with passion. You will grow to the extent possible, whatever you want to grow. So that is this thing. And as Madam told, power, knowledge is power. If you have knowledge, you can face anybody boldly, and you can talk to anybody boldly. And nowadays, expectations of the patients are increasing. You should have ample knowledge, whatever you are doing. Subspecialties have come. Take one specialty, be perfect in that. Then you can grow to the extent possible, whatever you think. That is my advice to all of our nursing staff. Finance, I'm telling you, the last, you should keep it last. It is more important. It is more important. I know that it's more important, but you keep it last. Automatically, if you do, it will come automatically to you. People will offer good remuneration for you if you are doing good job. So please update your knowledge, work passionately, improve this thing, technology and communication skills. I think nursing profession, you will excel in nursing profession. Nursing profession nowadays is very, very important. I think all of you know, doctors come and go, but the nurses, they are with patients every time. So any healthcare system, particularly in hospitals, nursing profession, nursing department is the most important department. The break or make is done by the nursing department. So it is very important department. Those who want to join, those who are working, my advice to all of them is don't discourage yourself. It's a very good profession. There is a lot of growth, a lot of vacuum is there. You can grow to any level in anything. So keep this in mind and work properly, passionately, you will grow. That is my advice.
Thank you so much, sir. It was a very valuable thoughts, and you have provided the beautiful, immense insight, keeping the clinical, exposure in upfront and secondaries of financial benefit, of course, to comfort the client in the Yashoda industry and globally as well. So thank you so much, sir. We will also, you have visioned, and I think your great contribution to the Yashoda industry that we have improved the nursing professional standards, and we are continuing to do so. And thank you, and your valued foresight vision also will be always granted upon. And thank you so much because of, you gave your very valuable time for all of us. I would like to, urge to the nursing viewers and listeners that DMS sir, right from 30 years ago till date, whatever time you ask, if you want to streamline any nursing practice or process, he's always available. He doesn't just declare the order and go. He always sits with the small 2-year nurse, including, the senior administrative, and even with us. He will just see time motion study, the prime analyzing, route. He will always analyze from what it started and how it ended upon. So this is how we comfort the client at Yashoda. Thank you so much, sir. And I would like to even thank Dr. Chandrasekhar, all principal madams, Siddhama madam, Lisa, Gina, and Dr. Chandrasekhar. None but the education, Ms. Patyusha, VP Garu, Bimla Prasad Garu, and all the educators who are really doing great in bringing out the lot of the current trends in nursing practices. And even Dr. Amar, who is already now today, he's in back end, but then he's contributing his, a lot of his inputs. Thank you so much. And we'll connect this time. It was only with the college fraternities. We will again, develop our continuum rapport with you all. Thank you so much. And I urge everybody, stay tuned for the new telecasting webinars ahead. And thank you so much.
Welcome, madam.
Thank you.